I'm Gwen Darling. I think I've met all of you either before or today. Thank you so much for coming. I am the CEO of Healthcare IT Central, which is a workforce development and career center online. I'm also the editor of Healthcare IT Today. I write for Healthcare Informatics Magazine and the Hit Exchange Magazine as well. So I stay pretty busy and stay focused on workforce and career development. So that's why UIC asked me to moderate today. We're going to start. Several of you submitted questions when you registered for this luncheon. We're going to attack all of your questions first, hopefully leave some time at the end for some more questions if we haven't satisfied all of your needs. And so let's get started. We're going to start by introducing you to our very prestigious panel. David, why don't we start with you?
Thank you. Can you hear me okay? Are we here? Okay. Hello, everyone. My name is David. Is that better? Okay. Hello, everyone. My name is David Kushan. I'm the managing partner of Healthcare IS. We're based in Sacramento, California. Our firm works primarily with providers. About 20% of our business is helping them identify full-time employees. The other 80% is staff augmentation contracts. In terms of area of specialty, we have one practice that really focuses in pharmacy, IT, and informatics. Another practice that focuses in helping Cerner clients across the country, and another one focusing in the Siemens market. Thank you.
Hi, can you hear me? I have a rather soft voice. So, I'm Bonnie Siegel. I'm with Witt Kiefer. This is my first week with Witt Kiefer. I was with Sanford Rose Associates and CheckASearch and Hersher Associates. So I've been in the recruiting business for about 13, 14 years. Before that, I was with Dorenfest and Associates. So I've been in the healthcare IT area for a long time. I won't tell you how long, but but I enjoy the area and enjoy working also at UIC as an adjunct professor and helping people in their next step in their career. Mainly at Witt Kiefer, I'm going to be working with IT executives, CIOs, CMIOs, CNIOs, and other leading kind of senior IT leadership positions. But I'd like to see more people coming up through the ranks and becoming those positions.
Hi. The title of this I see is Bridging the Gap Between Education and Employment. I'm representing the education side, I guess, because I am on the faculty and administration at UIC. So again, from UIC, I welcome all of you here that are currently part of UIC as well as those that are thinking about it. My official role is the program director for the health information management programs at UIC. But I want to just tell you a little bit about what the different programs are that we have. We have undergraduate programs. We have a Bachelor of Science in Health Information Management that's always been campus-based, has been around since 1965. That leads to the RHIA credential. But we've done a lot of growth in the online arena over the last few years. We had initiated a post-bac certificate in health information management 2 years ago, which was meant to be an accelerated executive version of the undergraduate bachelor's degree program for those that already have bachelor's degrees to progress on who want the RHIA credential. And then starting this fall, we're going to have a progression program for those with associate degrees to go on and get a bachelor's degree that leads to the RHIA. So we kind of have covered the whole gamut there, the whole spectrum. And then once you get through that level, we have at the graduate level a Master of Science in Health Informatics that's been online for, I'm trying to think how many years, 10 years maybe, has been going very strong. We have I think it's 400 students now about, very good, very growth oriented. We have been doing a lot of things new in that area. You can do it as a project track or a research track that we're going to be starting up, so we cover both sides of it. And then we have a postmaster's certificate in health informatics for those that have advanced degrees, physicians, MD degrees, master's degrees, and other things. That is a concentrated flavoring of the courses. And we have a good number of students in that too. So both the master's and the postmaster's certificate are all fully online, so you can do it from wherever you're at.
Is that all?
For now. Stay tuned.
Hard act to follow. Hi, everyone. My name is Rachel Wixon. I've been working in healthcare IT for about 10 years now. I started on the vendor side. So I worked for Epic in Madison, Wisconsin. For those of you who are on the Chicago campus, you may know where that's located. And in that capacity, I served both as a project manager, so started out really kind of at an analyst level, putting in systems, doing process reengineering, and also worked later on in sales. And with them, I also worked in their U.S. office and had an opportunity to work abroad in the Middle East, helping them set up an entity there and do some sales work in the region. So I've been kind of around the world, and it's a really exciting industry to be in. More recently, about past 18 months, I started with a couple others, a consulting firm. So I've switched courses a little bit and have been in consulting. The name of the company is SIPE. We do some staff augmentation, some project management that's not directly related to vendor work, but still related to putting in EMRs. And work a lot with Epic, do some with McKesson and Meditech so far, and looking to grow and expand, and also very excited to be working in a very fun industry.
Hi, I'm Carter Groom. I'm the CEO of First Choice Professionals, and I want to thank Joan for having me here, and thank you, Gwen, for putting on this event. And to those of you that are joining us, smart move in coming to HIMSS. Really, that would be my number one advice. If you are looking to break into this industry, be at this event. My company, First Choice Professionals, is an IT advisory and consulting firm that serves both federal and commercial providers, mostly hospitals, and we have 4 core business areas: clinical solutions, revenue cycle solutions, management solutions, and technical solutions. Thank you.
Hi, I'm Mike Cohen, and I speak real loud, so I'm going to back up in the microphone. I'm president of MRC Consulting Group, basically my own company, a one-man independent, built on a virtual model where I do a lot of work with and through other independent consultants. I've been in the industry forever, back when we were still using punched cards. How many of you even remember what a punched card is?
Oh, sure.
Okay.
Of course. Yeah.
But I've been on 3 different sides of the healthcare market, as an administrator, as a vendor, but mostly as a consultant, with big 8 firms, with a small but well-known independent, and mostly on my own for the last 12 years. Specialize in helping hospitals and physician offices make and implement their big-ticket IT decisions. It's mostly strategic work, strategic planning, vendor selection, and whatnot. I just wanted to add one thing onto what Carter mentioned. He had the great statement that if there's one thing you could do, that there was only one suggestion he'd make. He said, "Come to this event." To build on that, there's also chapters in most of your areas. How many of you are from the Chicago area?
Yeah.
Okay. The Chicago area chapter is the biggest in the country with over 2,500 members. And we put on a number of educational programs. We also have a professional development set of programs that's targeted at just what this program's about. And they're terrific networking events, so you should also keep those in mind. And just in interest of fair disclosure, I am president-elect of that chapter, so I'm a little bit biased. But it's but they're really great programs worth going to.